Primarily, I treat patients who have obesity. I also treat patients who have diabetes, high blood pressure, and other health consequences from weight. Truly, obesity is a consequence of our own bodies, of genetics, of hormones, of a whole bunch of situations coming into play.
With one surgery, you can take care of the person. You can take care of multiple medical problems they have, the diabetes, blood pressure, cholesterol, the risk for heart disease, bad knees, joints, reflux. You actually can impact the whole person and their lives and their family's life. This one surgery could do so much.
Something about the feeling that I get when I get to tell a patient that their diabetes is gone or that their blood pressure medications are not necessary anymore is really fulfilling.
Laparoscopy makes it even better because it's a small incisions. The recovery is faster, the complications are less, you heal faster. And the treatment of these patients has to be comprehensive. It just cannot be surgery, it just can't be medicine. It's a whole team approach to the problem with all the experts under one roof to get the best results. We have dietitian, we have psychologists, we have other clinical staff which will help person recover not only through the surgery but also with the changes that come with it. This is not just a surgical procedure. This is a complete intervention on a person so they can be helped to the maximum and sustain it.
Here at Mercy, I think we really offer a tailored approach. We have the time to sit and figure out exactly what each individual patient cares about and needs and tailor our approach to them.